What you're about to see is just a snippet of one of my Thursday live Q&As that I do with my clients to reversing disease and getting rid of belly fat. So hopefully this helps those of you that are taking blood pressure medications to know what to be aware of, especially when it comes to muscle loss. Share with everybody what your blood pressure numbers were last night.
Okay, sitting was 109/65.
109/65.
And
Way too low. Doctors have prescribed him way too much medication. Doctors, they are taught push your blood pressure down. The drug companies find a way to put out some research out there that you guys need to be having lower blood pressures. There's even articles right now that other clients have sent me and said, hey, what do you think about this? Better blood pressure at 115 over whatever. I'm like, no. You know who wrote that? You look at the fine print. It will come from one of those companies that's trying to sell those drugs. Bill has been having a low blood pressure problem for quite a while. And at the same time, he's lost a lot of muscle tissue. You feel like you're whittling away. What I
right,
wanted to bring up today was the connection of vasopressin, which is a hormone that causes muscle loss. You've had all this low blood pressure. We've been trying to get you off of these medications little by little. Your doctors don't agree with us weaning you off. They just want to keep you on them.
this whole thing started with the operation. Before that, I was fine.
He had an operation for a two-way bypass. After the two-way bypass, we came into this unfortunate situation of the low blood pressure. He was in the hospital for this surgery. He had to recover from that, and the doctors prescribed him medication. So a lot of times when doctors are prescribing, they just give you, oh, here, take this, take that. They don't take a step back and go, wait a minute, let's look at the whole picture here. So what we're doing right now is he's texting me what his blood pressure is at night. And that way we can see if it's safe to wean off. And every week when we meet, we're at a point now where we say, yeah, you're still too low. So here's the connection. When your blood pressure is low, a hormone called vasopressin shows up. Vasopressin, when that hormone shows up, muscle growth goes down. This is why you have had your body, you feel like it's whittling away. Because you did say you felt like I'm going to disappear.
Right,
Low blood pressure, vasopressin is high. You can't afford at 77, is that how,
right.
7 years of age to lose any more muscle. You need to stop taking that beta blocker at least one day and then give me your numbers.
Okay.
And when I see those numbers, then we'll decide. Let me ask this. What, as a fireman, as a paramedic, what do you guys want to see for blood pressure on a person?
Usually, normally is about 120/80.
Exactly. Even it needs to be at 120/80, which by the way, it used to be higher years ago. I can't remember when I first started what the number was, but I'm sure someone can do some history and you'll find that blood pressures in the 130s are fine also. Okay.
Yeah, we used to get 130/80s too.
Well, can you go over what they tell you in fire department paramedics?
I remember when I first came in, it was 130/80, and then later on in life, it became like 120/80.
So while he was going through his education in the firefighter world and I'm going through it in the medical, we both went through that transition. And guess what, guys? Pharmaceutical companies wanting to make more profits. How do you get more profits? Put more people on the drug. I went ahead and did the research and inserted the slide here to show you over the course of years what blood pressure targets were. In the 1970s, it used to be 100 plus your age would be considered something to worry about. So let's say you were 50. If your blood pressure was 150 on the systolic, which is the top number of the blood pressure number, then that was cause for concern. And then in the 1980s, you see here, the target was to be under 140/90. And then in 2017, they wanted blood pressure to be targeted under 130/80. And it was 2024 that the target was set for 120/80. So you see, over the course of years, they moved the goalpost for blood pressure lower and lower and lower. And what did this do? It put more and more people on high blood pressure medication. The reason I share this with you is do know that doctors have good intentions. They're just caught in the middle, sometimes pawns of the pharmaceutical industry by pushing them on to the patients of well-meaning doctors. If you're interested in reversing disease and getting rid of belly fat and doing it the natural way, the simple and effective way, look down below this video. There's a link to my calendar. Get on that, and I'll look forward to talking to you on the other side.